Hello everyone, welcome back to my channel nursing.com. Today we are going to learn about diarrheal disease in pediatrics. तो चलिए शुरू करते हैं इंट्रोडक्शन से. Diarrhea means passing of loose and liquid stool 3 to 5 times a day and more than 5 to 7 days. In diarrhea, change in consistency and character of stool. Diarrhea increase under 5 mortality rate. Malnutrition makes diarrheal disease. Dysentery means passing of loose and liquid stool with blood or pus. Agent factor in that mostly infectious. Viruses, bacteria, parasites, fungi. Spread of infection by parenteral route from other infections. Dietary and nutritional factors in that overfeeding, underfeeding or malnutrition, food allergy and food poisoning. Non-infectious causes in that congenital anomalies of GI tract, malabsorption syndrome, inflammatory bowel disease, immunodeficiency condition, inappropriate use of laxative and purgatives, emotional stress and excitement. Reservoir of infection in that main, some enteric pathogen and viral agent. Animal are important reservoir. Host factor in that most common in 6 months to 2 years, highest in weaning period, reduced maternal antibodies, lack of active immunity, introduction of contaminated food or a direct. Host factor of diarrheal disease in that most common in 6 months to 2 years, highest in weaning period, reduced maternal antibodies, lack of active immunity, introduction of contaminated food or direct spread through child's hand. Most common in artificial feeding. Contaminated cow's milk or unhygienic milk. Predisposing factors in that prematurity, immunodeficiency conditions, lack of personal hygiene, inadequate food hygiene, incorrect infant feeding, illiteracy and poor socioeconomic status. Environmental factors. Bacterial diarrhea is more frequently occur in summer and rainy season. Viral diarrhea found in winter. Mode of transmission in that fecal-oral, waterborne, foodborne, transmit via fingers, fomites, flies or dirt. Types of diarrheal disease in that secretory diarrhea, osmotic diarrhea and motility diarrhea. First we will see secretory diarrhea. In that decreased absorption and increased secretion caused by external and internal secretagogue, means a substance which promotes secretion. Tendency to be watery, voluminous and persistent even if no oral feeding. Osmotic diarrhea in that ingestion of poor absorbed solute like alcohol, sorbitol, maldigestion, small bowel defect, watery and acidic with reducing substance. Motility diarrhea in that increase or delay motility of bowel. Classification of diarrhea in that acute diarrhea in that passing loose stool 3 to 5 times a day more than 1 week. In chronic cases, passing liquid stool more than 2 weeks. Clinical features of diarrheal disease in that watery stool, blood or pus in stool, cramping like abdominal pain, weakness, lethargy, muscle cramping, electrolyte imbalance, decreased urine output, increased blood urea nitrogen, increased capillary refill time, dehydration, mental alteration, confusion, weight loss and failure to thrive. Diagnosis of diarrhea in that history collection, physical examination, X-ray, ultrasonography, complete blood count, erythrocyte sedimentation rate, C-reactive protein, occult stool test, stool culture and sensitivity, blood and sensitivity test, renal function test, arterial blood gas, hematocrit value. Management of diarrhea in that antibiotic therapy, anti-diarrheal agent, anti-emetic drugs, proton pump inhibitor, ORS. Nursing management of diarrhea in that maintain patent airway, assess vital sign, maintain fluid balance by IV therapy, maintain personal hygiene, avoid stored food and infected water, ringer lactate fluid of choice in diarrheal disease. Thanks for watching.